Margaret, 68, couldn't hold her granddaughter's hand because of her RA. Then she tried a TNF blocker, and just weeks later, she was braiding the little girl's hair again. But what the ads don't always say? These drugs don't just calm your joints. They also suppress part of your immune system. For many, that means real relief. For others, it comes with unexpected risks, especially after 60. Today, we'll break it all down: how TNF blockers work, who should and maybe shouldn't use them, and 5 safe, natural options that can support your joints alongside treatment. What is TNF? Let's clear something up first. TNF doesn't mean you have cancer. The name sounds scary, tumor necrosis factor, but in this case, it's just outdated science talk. TNF is a protein. Your body makes it to fight infections and injuries. Think of it like a fire alarm. It calls on your immune system to clean up damage. But in rheumatoid arthritis, that alarm malfunctions. Your immune system starts flooding the body with TNF, even when there's no danger. Instead of healing, it starts attacking healthy joints. You get swelling, pain, stiffness. Over time, TNF keeps the inflammation going day after day. Doctors call it a driver of RA. Because without controlling TNF, it's tough to stop the damage. How do TNF blockers work? So, how do TNF blockers help? These are called biologics, meaning they're made from living cells, not chemicals. And they're smart. Instead of wiping out your whole immune system, they target just one part, TNF. Imagine TNF as a key that turns on inflammation. TNF blockers act like clay in the lock. They block the key so it can't start the fire. There are a few common ones: Humira, Enbrel, Remicade. Some are injected under the skin, others come through IV. Most are taken once a week or once a month. And for many people, they work. They reduce stiffness, calm flare-ups, make walking easier again. But they don't fix the root cause. They turn the signal down so the damage slows. Oh, and before you start, ask about biosimilars. These are approved generic versions, and they can cost 30 to 40% less. Is a TNF blocker right for you after 60? Not every senior with rheumatoid arthritis needs a TNF blocker, but for some, it can mean the difference between waking up stiff or waking up strong. So how does this treatment fit your life? You might be a good candidate if you've already tried other medications, but your symptoms keep coming back. Maybe methotrexate made you feel queasy, or your joints still ache, even after weeks on sulfasalazine. Doctors often consider TNF blockers when RA continues to flare, especially if you've had swollen joints for over 6 weeks. Blood work shows high levels of inflammation. Daily tasks like buttoning a shirt or using stairs are becoming harder. With proper care, many people over 65 find real relief using these medications safely. You might need to pause and plan if you've had serious infections recently, like pneumonia or shingles. You live alone and might miss early signs of illness. You're about to start cancer treatment or have had hepatitis B in the past. You haven't gotten your shingles vaccine yet. Live vaccines must come before treatment begins. Here's a tip. Ask your doctor about a readiness checklist. It covers everything from vaccines to lab tests and helps avoid surprises. TNF blockers aren't one size fits all. They work best when matched to your unique health, lifestyle, and support system. Talk with your rheumatologist, not just about symptoms, but about your whole picture. What side effects to expect? Margaret showed up to her follow-up visit with a notepad full of questions. Her rheumatologist, Dr. Linda, greeted her warmly and took her time. No white coats, no rush tone, just 2 women talking honestly. First, they covered the common side effects. You may feel a little tired after each injection, Dr. Linda explained. Sometimes the skin where the medicine goes in can turn red or feel sore. That usually fades within a day or 2. Margaret scribbled down mild fatigue and skin reaction on her list. But then Dr. Linda paused. This next part is more important, she said gently. Because these medications affect your immune system, you'll need to be more alert to signs of infection. She leaned in, speaking clearly. If you get a fever, chills, or a cough that doesn't go away, don't wait, call us. Even something that seems small, like a UTI or skin sore, can turn serious faster than before. Margaret looked up, concern in her eyes. Dr. Linda continued, and yes, You might have read about rare risks, like certain types of cancer. Those are extremely uncommon, especially with today's safety monitoring. But we include them so you're informed, not scared. Then came the part Margaret appreciated most. We'll track your blood work regularly, Dr. Linda reassured her, and if anything doesn't look right, we'll catch it early. By the end of the visit, Margaret still had questions, but she also had confidence. Natural supports that can help without replacing meds. The following week, Margaret returned to the clinic with a different question. Are there any natural things I can do, she asked, to help my meds work better, or at least make my joints hurt a little less? Dr. Linda smiled. Yes, but we're not talking miracle cures, just smart habits. She started with anti-inflammatory foods, salmon, walnuts, chia seeds, all rich in omega-3s. They help quiet the background inflammation that TNF blockers can't always reach. Then she pointed to a water bottle on the desk. Hydration helps your joints stay lubricated and your body flush out toxins. Simple but underrated. Margaret nodded. She'd been drinking more tea lately, unsweetened ginger and turmeric mostly. Perfect, Dr. Linda said. Those herbs have mild anti-inflammatory effects too. Just don't overdo the supplements. Next came movement. Even gentle stretching keeps blood flow active in your joints, and circulation helps medication get where it needs to go. Margaret scribbled again, writing, water, salmon, stretch. Finally, Dr. Linda added something important. These won't replace your medication, but think of them like teammates. They support your body from the outside, while your TNF blocker works on the inside. Margaret smiled. It felt good to know she could help herself, without chasing false promises. A daily routine that respects your joints. Rheumatologist Dr. Janice Ellis often reminds her older patients, you don't need a boot camp to protect your joints, just better rhythms. And the science backs her up. Recent research from the Arthritis Foundation highlights this. Seniors with mild movement routines every 90 minutes report less stiffness and improved circulation without needing intense exercise. Let's walk through a day designed for your joints. Morning, 7-8 a.m., start with a warm shower, then 5 minutes of gentle stretches, ankle circles, shoulder rolls, or seated leg lifts. These light movements wake up your synovial fluid, the body's natural joint lubricant. Mid-morning, 10:30 a.m., instead of sitting through the morning, take a 3-minute standing break every hour. Walk to the window, roll your wrists, gently shake your arms. Studies show this helps reduce joint pressure buildup. Afternoon, 3 p.m., take your anti-inflammatory snack walk, a slow-paced stroll for 10 to 15 minutes, paired with a few walnuts or a cup of green tea, can support mobility and reduce swelling markers like TNF-alpha. Evening, 8 p.m., before bed, apply a warm compress or rosemary oil massage to the knees or hands. This soothes stiffness and signals the body to relax. Bonus tip: set a gentle reminder on your phone. Move for 3 minutes every 90 minutes. Small steps, big difference. Final thoughts on TNF inhibitors. Let's step back for a moment. If you've made it this far, you're either using a TNF inhibitor or considering one. And that's a big decision, especially after 60. Here's the truth we've learned together. TNF blockers like Humira, Enbrel, or Remicade don't cure rheumatoid arthritis, but they can slow the damage, reduce pain, and give your joints a second chance when used wisely. What matters most isn't just the medication, it's your whole system. 1. Regular check-ins with your doctor. 2. A smart, gentle routine that respects your joints. 3. And anti-inflammatory support through food, sleep, and stress care. If you felt overwhelmed by the risks, remember this. Millions of seniors use these medications safely. You're in control with the proper monitoring, lifestyle, and information. Your next step? Not to decide today, but to bring better questions to your next appointment. Ask your doctor about your infection risk, your heart health, your vaccine status. Knowledge isn't just power, it's protection. And as always, don't go it alone. Let your support system know what you're trying. Because this journey isn't about fighting RA, it's about reclaiming life with confidence. Your path forward with TNF inhibitors. Let's take a breath together. Do you remember Margaret? 6 months after starting her TNF blocker, she was doing something simple but meaningful, braiding her granddaughter's hair every Sunday, just like she used to. No, it didn't cure her RA, but it gave her strength back, confidence, the ability to say yes again. Here's what we now understand. These medications, Humira, Enbrel, Remicade, work best when they're part of a system, not a solo act. Medical treatment targeting inflammation, gentle movement to protect your joints, food and rest that reduce daily flare-ups, and conversations with doctors who listen. Yes, there are risks, but they're manageable. Millions, over 60, use TNF inhibitors safely with screening, vaccines, and simple awareness. What's next isn't rushing a decision. It's preparing to ask better questions about your history, your lifestyle, your goals. You don't have to fight RA. You need to stop letting it steal quiet joys from your life. When you understand what's happening inside your body, you stop fearing it. You start working with it. That's how we protect our future. Not by fear, but by knowing. Your next steps. You made it to the end. That means something. It means you're not here to guess anymore. You want facts, tools, options that respect your age and your strength. So here's your next step. Watch 7 anti-inflammatory foods that work for RA after 60. Real food, real science, and real results. That video has helped over 50,000 seniors feel stronger in just weeks. Then, claim your RA Confidence Checklist, linked below. It's free, designed by experts, and this week alone, 700+ seniors have downloaded it to track pain and swelling, understand blood work, prepare for better doctor visits, and if Margaret's story felt like yours, then hit subscribe. We're not selling you pills. We're building a library of support, one decision at a time. Turn on notifications because the following video might be the one that answers a question your doctor hasn't explained yet. And tell us in the comments, what's your biggest RA challenge right now? Someone in this community has walked that road, and they'll walk it with you. You're not just learning, you're reclaiming your life, and we're honored to be part of it.